afternoon and welcome to Clinical Pearls. I'm your host, Caroline Cartledge. Today, I'd like to welcome Dr. Marisa Wilson. Dr. Wilson is an associate professor here at the UAB School of Nursing. She's the specialty track coordinator for the Nursing Informatics track and the director of the MSN Leadership Pathway. She completed her Doctor of Nursing Science from Johns Hopkins University in 2005, and her current work interests include national and international nursing informatics competency among healthcare professionals, incorporation of the social determinants of health, and nursing leadership in population health endeavors. Welcome, Dr. Wilson.
Thank you very much for having me here. I'm very happy to talk a bit about this specialty.
We're happy to have you here. So tell us just, first off, just what is informatics?
This is a very misunderstood specialty, I think. It is not new. Many people feel that this specialty is new because they're seeing a resurgence of implementation of computers into hospitals in the last 10 years, and they're finally seeing the nurse informaticist coming forward. But this specialty actually dates back to the 60s, when computers started to make their way into hospitals, mainly for paying bills and that kind of thing. In the 60s, there was a word, informatics, coined. It was actually a French/Russian word that essentially looked at how we turn data into information. In the 80s, a very forward-thinking group of nurse leaders tried to take that word and figure out how would that apply to the nurses who work in the hospitals and ambulatory centers. So they started to craft a model based on these new computers that were coming into the hospitals that really looked at how they could turn data to information to knowledge. In the 90s, another group of advanced nurse leaders started looking at how can we actually craft a role, a specialization within nursing at the graduate level for nurses who would lead these endeavors for using these new systems to turn data to information to knowledge. So informatics is as old as the computers that have been in hospitals. We're just seeing it more and more now because of the increased implementation of various systems within the healthcare settings, whether that's ambulatory or acute care or out in the community. Informatics has a definition in nursing. The American Nursing Association defines this within our scope and standards of practice, and it has gone through many revisions as computer systems become more sophisticated. But it's essentially the combination of computer science, information science, nursing science, cognitive science in the application to assist better outcomes among patients, providers, communities, all the people that we care for as nurses.
I'd like to talk more about how informatics has evolved as our technology has expanded a little bit later. But you mentioned nursing, it being a specialty. So nursing informatics is a nursing graduate specialty, is that correct?
Yes, it is. In the 1980s, that group of forward-thinking nurse visionaries began to take that model of data to information to knowledge and some early thinking about the role, and they crafted the scope and standards of practice in the American Nurses Association and actually created a graduate level specialty of nursing informatics with 16 scope and standards and competencies and expectations. The first scope and standards of practice for nursing informatics specialization was in 1994, after all that preliminary work occurred. Then in 2008, it was updated. In 2011, it was updated, and we are once again updating the scope and standards of our practice to meet the current technology needs of today and the needs of patients today. So it has been a specialty for quite some time, 2 decades at least. One of the first schools to offer a master's program in nursing informatics was the University of Maryland School of Nursing, followed by Utah. The program here at the University of Alabama at Birmingham School of Nursing has been around for a decade. So we're one of the newer programs that are offered for informatics nursing specialty, but it is a graduate specialty track. It is not offered in every nursing school, but it is offered at the major large universities who have the expertise to teach and mentor students in this specialty.
Absolutely. Well, we're definitely thankful for your expertise. So I know that nursing informaticists work with electronic health records. Tell me about some of the other technologies that your specialty works with.
That is about as endless as the technologies that get developed every day. And as you know, you buy something today and by this afternoon it's now old. So yes, a lot of nurse informaticists or informatics nurse specialists, and I will talk about this a bit, work with electronic health records. That tends to be the technology that most people associate with the informatics nurse. However, that's not the only technology. Nursing informaticians, nurse informaticists work with personal health records. You may have one from your own provider where you get your information and data after your care. They work with mobile applications. They work with social networking. Many people go to Facebook and Google to get their health information. So we have nursing informaticists trying to use those platforms to actually change behavior and health outcomes. We have nurses working with robotics, which is very exciting, nanotechnology, sensors. It's rather unlimited. We have nurse informaticists who are creating mobile devices that people wear. Many of us know about the Fitbits and things that people wear, but there are actual medical grade devices that have been FDA approved that patients will wear that will send data right back to their doctor in order, their other providers, nurse practitioners, in order to make changes in their care to improve the outcomes. So we have nurse informaticists working with that. So it is endless and always changing.
Which is really exciting. As a nurse with family who are not in the healthcare field, they are excited about the technologies that you're talking about, the Apple Watch and the Fitbit, and are quick to Google things when they're experiencing symptoms. And it's encouraging as a healthcare provider to know that you guys are behind the scenes wanting to make that information usable and reliable. That's exciting.
Well, one of the very important roles of the nurse, the graduate level nurse in this specialty, is working in social networking, because 70 to 80% of people, either before they see their provider, go to the internet, or after they see their provider, they go to the internet to answer the questions they didn't ask while they were there. They make decisions based off of information that they get from the internet. Some of that's good and some of that's not so great. So the informatics nurse can use their skills of nursing, and they can use their skills of that platform to allow people to become engaged in their own healthcare, activated in their own healthcare, educated but in a safe way, so that they can explore and learn using internet-based resources, but they're doing it with safe sites that are providing legitimate information, that are monitored and mentored by someone who knows something about the topic. So that's a very exciting avenue that informatics nurses do work in.
Yeah, that's incredible. I've heard you use several terms since we started talking. Can you explain a little bit about the terminology that surrounds the field of informatics?
Yes, because this creates a lot of confusion. Our specialty, the informatics nurse specialist, is much like the clinical nurse specialist, which many are familiar with. That is a graduate degree nurse who has a specialization, who has taken a certification exam. However, nurses who work in this field with graduate training often come with a variety of titles depending on what their job has called it. Some are called nurse informaticists, others are called clinical analysts. There are many, many titles, but the title of informatics nurse specialist really is only supposed to be for the nurse who has gotten the graduate degree in informatics from a program in an accredited school and has taken the certification exam. The rest of the roles, it is really up to the employer to determine what the requirements are for those roles.
So I know we've talked previously, there's nursing informatics, but there's also informatics in other fields, is that correct?
That's correct.
Okay.
We work with a large interprofessional team. Many of the other healthcare provider types, physicians, pharmacists, social workers, nutritionists, have carved out informatics as a role within their specialization track because there's such a need to figure out how to use these technologies and the data and information and knowledge to support their specific professions. So we work with our colleagues who are medical informaticists, biomedical informaticists, pharmacy informaticists, as one team to make products that touch all these venues.
Absolutely. So you mentioned licensing or being credentialed. What does that look like post receiving higher education in informatics?
Well, to enter a nursing informatics graduate specialty, much like any other specialty, one must hold a bachelor's of science in nursing and have an RN licensure. So we're still licensed as nurses, we are still practicing nurses, and we maintain that license. However, upon graduation from your master's programs, the person who has studied informatics nursing in a graduate program is faced with several certifications that they can take. The American Nurse Credentialing Corporation, or the ANCC, offers certifications in a number of graduate nursing specialties, including many of the nurse practitioners. They also offer certification in nursing informatics. Now, this is at a generalist level. It requires a master's degree. It requires so many CEUs in order to be eligible to take it, and 200 hours of precepted mentorship as part of your education. Most of the nurses have much more than that. They can sit for that foundational generalist certification exam. However, there are more after that. And as you see from my title, I have several of them. I have them because I'm a faculty member and I really need to know, what's in them and how to ensure that our students can sit for those exams. But those exams often require many more years of practice and experience as a practicing informatician. So we have certifications out of the Health Information and Management Systems Society, otherwise known as HIMSS. Mm-hmm. They have a CA-HIMSS and a CP-HIMSS certification that's more akin to how you would certify if you were in a role of a Chief Information Officer. We also have nurses who sit for certifications through project management, PMP, project management professional, because there's a lot of that goes on in this role. We have nurses who sit in on other advanced certifications that target informatics. So there are a variety, but the foundational certification is the one out of the American Nurse Credentialing Corporation, and that is the RNBC.
That's helpful. Mm-hmm. In thinking about bedside nurses working in the hospital, what's most important for those nurses to know about what their nursing informatics at their hospital does?
First of all, they should know their nurse informatician. Often you ask them if they've ever met the nurse informatician, and they really haven't. So they should look for that person, because that person can be very helpful to what they do. The nurse at the bedside today, I don't care where the bedside is, it can be in the ICU, the med-surg, labor and delivery, out in the community, in the ambulatory clinic, will not escape technology or the data collection process. So they need to be able to work with these technologies. They need to be able to fit them in with their workflow and their data collection needs, incorporating them in with their care of their patient. In order to do that, they should be working hand in glove with the trained nurse informatician or the informatics nurse specialist, whatever that role is in their facility, in order to make that happen. They will be surrounded and immersed with technology as they enter, whether that is an EHR or a nursing documentation system or a monitor that they have to use. Either way, all of those things are informatics tools that need to be properly implemented with the help of these specialized roles.
I remember being a brand new nurse and barcode scanning coming out, being rolled out at the hospital that I worked at. And I can remember being asked by our team what would be most helpful. And I remember kind of being shadowed, and I remember getting to pilot the system. And I was really, that was the first time I was ever really exposed to nursing informatics. And definitely have developed an appreciation for the way that you're talking about, their input, knowing exactly what I did on a daily basis. So definitely developed a respect for what your team does in that time, for sure.
Often the informatics nurse specialist is the translator between the clinical bedside needs of the nurse at whatever level they're at, whether they're the direct care nurse, the nurse manager, the director of nursing, and the information technology people, the computer scientists, who don't really have an understanding of how we think and what we do. So that informatics nurse specialist really has to be the translator between those two worlds, or you may get what you may not want. So they're the ones that are going to help you get what you need to do your job.
Which is just incredible.
Yes.
We need that. What are some common misconceptions about informatics?
First, that it's new, and it's not. It's as old as computers coming into hospitals. I have a video that I show my students from a hospital in 1968, and it's a nurse in her white starch cap with a new computer, and they're like, wait, that really was? Yes, 1968. Toledo, Ohio. Some other misconceptions is that we are the computer repair people. No, there are computer repair people on site, and some of my informatics nurse specialists can repair computers if that's what they want to do. Or that they're the programmer. And that's not really the role either, although I do have nurses who came to this role with a background in computer programming and have combined this degree with their nursing degree, which is kind of exciting. So they do that, but that's not really the role. So those are some of the two biggest misconceptions about the role.
I can believe that. So how does a nurse informaticist work within an interprofessional team? We kind of talked about that early.
Right. Well, none of us work in a vacuum. So we have to work as a team. The informatics nurse specialist will lead an entire project or lead parts of a project, but can only do that with the hand-in-glove work with the clinical colleagues. That may be nurses. It could also be pharmacists or dietitians or social workers. They work with their clinical colleagues as part of a team. They work with their computer scientists as part of the team, their database architects, their LAN administrators, their fiber optic people. It takes this entire team in order to make this project successful. From the very smallest contained project to the largest EHR implementation, which costs millions of dollars, all of it is reliant on the team working together to make this product work for everyone.
Could you give us an example of a specific project that you've worked on recently?
Absolutely. In order to demonstrate the need for the interprofessional, multidisciplinary team, I do want to highlight my last operational role that I had, and that was in the operating room. I was the project director for the operating room implementation at Johns Hopkins. This encompassed 3 facilities, 96 ORs, all the procedure areas such as CVDL and all that. And our job was to bring in a new scheduling, documentation, billing, materials management, case cart, sterilization processing system.
Wow.
That was a multi-year project that required various members of the team to be part of it. Not just the director of surgical nursing, not just the directors of the various surgical areas at Hopkins, but the materials management, the sterile processing people, the biomed people, because they were putting equipment in operating rooms. It required the engineers, it required the infection control individuals. If you think about it, if you have computer equipment in an operating room, how do you clean those when you do the terminal cleaning of the operating room? So we needed our infection control, we needed our billing colleagues, we needed the surgeons, the anesthesiologists, the surgeons' administrative assistants who do the scheduling. It was quite a large team that had to stay together over many years to make this work.
That's incredible.
Yes.
That sounds like an exciting opportunity.
Yes, it
and
was.
I'm sure it felt good to see that come to completion and to work effectively for sure.
Yes, it was.
What kind of exciting opportunities do you see coming for this field?
Again, this field never changes. It's never stagnant. Right now, we're revisiting the whole field of the electronic health record implementation because we're having some issues with burnout and documentation burden. Often within the realm of electronic documentation, it's very easy to build new forms and new screens for people to complete without really considering what that has to do and what that does to the bedside caregiver, adding more burden to their day. So there are a group of very forward-thinking nurse colleagues, informatics colleagues, who are working on that whole area of taking a step back and looking at these EHRs that we have implemented and determining how can we reduce the burden on the nurse, who in some cases is spending 20, 30% of their time in the EHR and spending time after their shift documenting and feeling burdened and overworked. So that's happening, and I think that's really exciting because that's forcing us to relook at what the electronic health record does. But we also have new technologies that are happening out there that are very exciting. The whole field of robotics is really exciting. We have older caregivers that are trying to provide care to patients in the home or in the hospital setting. Some of our older caregivers, our providers, they can't be lifting patients and moving them around. So there's a whole research arm that's looking at the use of robots to help with these mechanical things that we have to do to prevent injuries to nurses. That's very exciting. I've seen the use of robotics in the control of dementia symptoms. They have these robots that just sort of look like seals that the patient can hold and pet, and it coos and it vibrates and it seems to relax the patient with dementia. We have small childlike robots that are being used to train children with birth defects and other handicaps with cerebral palsy and things like that. I think that's very exciting. We have researchers who are working on technologies to allow people to age in their home using sensors. They have sensors placed in the either assisted living facilities or in someone's home that can monitor their activities so that you can make sure, did they get up? Did they go in the kitchen? Did they go in the bathroom? How does the pattern of data that we're seeing from the sensors differ from their normal pattern? Does there need to be an intervention to go in and make sure they're doing well in their home? So I think that's all very, very exciting.
I think it's exciting too. Mm-hmm. It's incredible. Even some of the things that you're talking about, I didn't know that mm-hmm. there were teams of people working on. I think I just had a friend the other day who's a bedside nurse telling me she had to do several admissions in one shift, and she was telling me about that took some time, and it makes me excited. The first part of what you were talking about, that there are teams of people looking at the electronic health record and looking mm-hmm. at those forms and how easy they're to create, and looking at the burden that places on
right.
the nurse. That's so helpful.
Right. I am not a new nurse, so I remember the days when it was paper. And if you had to create a new form in a paper-based world, it was a long, arduous process. You had to go in front of a forms committee, and you had to have the form created, and you had to wait for the other million forms to be done with. You had to print them up. So there was a long, protracted process to creating these paper forms in the paper world. And so it wasn't done so quickly. But once we move into an electronic world, When someone comes to the team and says, we need a form to do XYZ, it's much easier to turn that around. Unfortunately, I personally think too much of that happened. So we had sort of this growth of electronic screens and forms within EHRs, which just burdened the caregiver, generally the nurse. So I'm very happy to see that we are taking a look at that. Some of that's being driven by the federal government and federal policy with the 21st Century Cures Act that came down and said we are burdening providers of all types. They were specifically looking at physicians, but those of us in the world of nursing know it's a burden to nursing. So we are all taking a step back and we are looking at how we can do this better. This is being driven from federal policy level now, but also from informatics nurse research into what we actually need to document. What do we actually have to do to gather the information on the patient to create that data information to knowledge that's really needed?
Yes. So how would you, knowing what you know and the things that you've told us, how would you encourage nurses in the field to thrive within this technology revolution?
The one thing we have all of our students do, and they must do this right away, is to join a professional organization. And there are several that focus on nursing informatics. Because our field is not stagnant, it is always changing, it's always developing. In order for them to stay at the top of their game and to understand what's out there and what's new and exciting, they have to involve themselves in a professional organization. They have to attend the meetings, they have to hear what their colleagues are doing, and then they have to really consider how that gets translated and moved into their own work.
Absolutely. How have you seen this change throughout your career, change your research?
Again, we started off just trying to figure out what computers can do for nurses. How can we use these new devices to collect nursing data? We still have a lot of work to do in that way, but we've now blossomed out to figure out how to use these technologies that collect data to information in order to provide better patient outcomes, to create evidence for our practice, to improve the care of patients, to improve the efficiencies and the effectiveness. So we've moved from just trying to figure out how to make a computer work for us to how to really make what we do support the patient, the provider, the consumer, the population, whatever we're serving. And I think that's probably the biggest transition I've seen.
So for nurses who want to know more, what kind of resources, you talked a little bit about professional organizations, but what kind of resources are out there for those nurses who want to know more about this field?
Well, I would certainly look into the programs. I highly recommend our program here at University of Alabama at Birmingham School of Nursing. Look into the programs. Make sure that you are looking at a program that offers the training that's needed for today's informaticists, that you will be taught by faculty who have experience in this field. That's extremely important, who will help to put you in practica where you will learn and grow and move into a new role. But for a nurse who's at the bedside, who is looking at new roles for themselves at a graduate level, and if this is something that is an interest to you, if you're comfortable with, obviously you have to be comfortable with the technology. So if you're comfortable with the technology, I always advise them to get involved with your organization's committees. You don't have to be the computer scientists or the informaticists to involve yourself in that barcode medication administration committee.
Right.
This will give you an idea of what this whole process is so that you are informed when you make a decision about what you want to do. I also provide them with the web links of the various professional organizations so they can take a look around. And so I will provide them with the web links for the American Medical Informatics Association, the Nursing Informatics Working Group, AMIA. I will provide them with the web link for the Health Information and Management Systems Society Nursing Informatics Group, or HIMSS. Both of these organizations offer information about this specialty from two different perspectives. AMIA is more research focused, HIM is more product and vendor focused. And I encourage the students to look around and join them as a student. The rates are lower. Take advantage of the continuing education opportunities that they offer so that they understand what they're getting into.
Absolutely. Well, Dr. Wilson, we are so grateful for having you join us today. Do tell us a couple of takeaways that you'd like us to leave and know about the nursing informatics field.
Again, that we use technologies, whatever technology is out there, and it changes every day, but we use technologies to create data, to make information, to form knowledge, and ultimately wisdom about our field. That is really what we're about and what we've been about since 1968, regardless of the technology that you're using. That we are nurses, we are still supporting our clinical bedside colleagues. We're considered indirect care providers, leaders. It's an exciting field, certainly one that never changes and one that offers very unlimited opportunities for the person who takes up this role.
Certainly. Well, thank you again for joining us.
You're welcome.
It's been a privilege to learn from you and speak with you today. So, and we're thankful for all of you for joining us on Clinical Pearls. Have a great day. If you enjoyed this video, please remember to like and subscribe. And don't forget to click the bell icon to get instant notifications when we release new videos. For more information on how to get CEU credits or to learn more about the UAB School of Nursing, check out the description below. Thanks for watching. See you next time on Clinical Pearls.